Bunions, also known as Hallux valgus, is the most common forefoot deformity that can cause both pain and decreased mobility of the big toe. In this video, we'll dive deeper into the common condition known as bunions. We'll explore their causes, symptoms, and treatments, focusing on non-surgical options and home remedies. We'll also discuss the role of footwear and exercises in managing and preventing bunions, providing practical tips and product recommendations to help you take control of your foot health. I'm Jessica Dudas, an osteopathic practitioner and athletic therapist based in Vancouver, Canada. I'm here to help you gain a better understanding of your injury, manage your pain, and provide evidence-based solutions and exercise rehabilitation. So if you struggle with bunions, by the end of the video, you'll have a clear understanding of how to manage them. So what are bunions? Bunions are a bony bump that form on the first metatarsophalangeal joint, or MTP joint, as I'll be saying throughout the video, which is the base of your big toe. It is a medical condition characterized by the tip of the big toe deviating laterally and the base of the bone begins to translate outward, creating a prominent bump. Bunions, also known as Hallux valgus, Hallux refers to the big toe, while valgus denotes a deformity where an anatomical part is abnormally turned outward away from the body's midline. So what are the signs and symptoms of bunions? A bump on the outside of the base of the big toe is most common. If it's acute, you may see swelling, redness, or have pain around the MTP joint. Calluses can often develop where the first and second toe come in contact. Pain can be constant for some or come and go with increased stress with load-bearing activities and time spent in compressed shoes. You likely are noticing a decrease in mobility in the big toe, starting to stiffen, or maybe there's some arthritis. And some people might not have pain with their bunions, and it might be more of an aesthetic complaint. So the exercises and management solutions I'll be talking about later in this video still apply. So who's at risk and what causes it? Genetics is one of them. A study in 2018 conducted over 2,600 individuals found that forefoot deformities, such as bunions, are common and tend to run in families. The study further suggested that more research is needed in the area of bunions and genetics. But probably the most common cause is footwear. Shoes that are too tight, narrow, or have a pointed toe box can push the toe into an unnatural position, crowding them and increasing pressure on the MTP joint. High heels, which shift the body weight forward, increases this pressure further, potentially accelerating the development of bunions or worsening existing ones. There's a reason bunions are seen more in women than men, and that's because of footwear selection and poor ankle mobility affecting gait mechanics. So limited dorsiflexion of the ankle during the gait cycle can be caused by previous ankle sprains or tight calves. This limitation forces our body to compensate and find alternative ways to achieve the required range of motion, which can lead to bunions. A common compensation method is to use the arch as a secondary ankle. This is achieved by pronating the foot, which results in a collapsed arch, providing false mobility. As a result, the side of the big toe flexes laterally, placing excessive pressure on the MTP joint. This is why bunions are more common in those with flat feet or fallen arches. Now we're going to get into the management, so the treatment and rehabilitation exercises. The first step involves addressing the primary cause. Then I'll guide you through mobilization techniques on the foot and toe and teach you about some of the key anatomy structures impacting bunions. After that, we'll focus on strengthening exercises for the intrinsic muscles of the toe and the foot to improve your alignment and your arch support. Finally, I'll provide preventative measures to effectively treat this dysfunction and answer some of the most common questions I get asked about bunions that I think you're probably wondering yourself. So let's jump into the first step, your footwear. So we need to address your shoes. You need to avoid narrow pointed shoes, especially those with high heels. Over the past 2 years, I've transitioned to Field Grounds and Vivo barefoot shoes, and this decision was driven by 5 main benefits. These shoes offer a wide toe box, they allow your toe to spread and enhance stability when walking. They are a zero drop shoe, which means they don't elevate the heel, thereby preventing compression in the forefoot and unnecessary ankle instability. They are also flexible, thus enabling free foot movement and muscle engagement. And additionally, they are lightweight and feature a thin sole for stronger connection connection to the ground. If you're interested in checking out these shoes, I'll link them in the description below. Now we are going to start with soft tissue release techniques. We're going to start with mobilizing the metatarsals and splaying your big toe and your second toe. One of the first things that I like to teach my clients is to mobilize their foot, specifically right around their midfoot, which is their metatarsal. And what you want to do is you just want to grip the big toe and your second toe and gently rock them back and forth, just helping to kind of stretch the muscles that attach in between these bones. And this will just help to splay the big toe from the second toe, helping to loosen it up before we start to strengthen the toe. So as I mentioned, the bunion forms at your MTP joint. Well, there is a muscle called your adductor hallucis muscle, and this muscle attaches to the inside of the MTP joint, is located at the bottom of your foot. This muscle has two heads that attach to the inside of the MTP joint, one that runs across the MTP joint and the other that runs on a diagonal towards the outside of your foot. So we are going to grab onto the big toe, and then we are going to just gently kind of strip down the midline between the first and second toe, working through the metatarsal specifically, and then just kind of trying to pull the toes apart. By splaying the toes, you'll help to stretch the adductor hallucis muscle, which will commonly adduct, and that's where it gets its name from. It'll pull it more towards the second toe. So we want to alleviate the pressure here before we start to strengthen the other muscles that help to abduct the toe. So now we want to strengthen the toe and the foot. So we are going to now abduct the big toe. So we're going to strengthen the abductor hallucis muscle and the tibialis posterior muscle. The abductor hallucis muscle attaches the inside of the big toe and it runs down to the inside aspect of your heel. Its role is to abduct and flex the toe and support the longitudinal arch of the foot. So the first thing and the easiest thing we can start with is just spreading your toes. Simply try to spread your toes, pull that big toe away from the second toe as much as you can. When you're doing this, you're helping to activate the abductor hallucis and you're stretching the adductor hallucis at the same time. So you're gonna do 10 repetitions and I want you to hold that splay for 5 seconds and you're going to perform 2 to 3 sets of 10 to 15 reps. Now the second activation exercise we're gonna do is a progression from the first one. You're gonna grab a mini band and put it around your toes, or a hair elastic if you don't have a band, with our feet planted. Align your big toe and push your big toe into the ground, and I want you to hold this for 5 seconds. So as I mentioned, when you bring your toes into alignment, we're increasing that inner arch of the longitudinal arch of the foot. And when we flex the big toe, we are activating that abductor hallucis muscle and you're contracting and trying to gain that strength and support for the foot. So for this exercise, I would suggest doing 2 to 3 sets of 10 to 15 reps. Okay, now the third one, we are going to do great toe banded side steps. Now we're going to progress to a standing load bearing movement with a band wrapped around your big toe and the opposite ankle to help pull the toe into correct alignment, which will allow the foot to have better foot control, supporting the longitudinal arch. Take a step to the side and do not resist the band outward pull on your big toe. Plant the toe, and then I want you to push your big toe firmly into the ground and hold for 5 seconds. Then you're gonna come back to shoulder width apart and you're gonna take another big step out and repeat 10 to 15 times. And now for the second muscle that we talked about earlier, which is your tibialis posterior muscle. This muscle flexes the ankle and inverts the ankle. It attaches to the bottom of the foot and wraps around the inside of the ankle and wraps around the back underneath the calf muscles. So this muscle is really important because it stabilizes the inside of our arch, creating that arch support that we need. So when we are walking, we are not collapsing the foot and overpronating. So the first exercise that we're gonna do for the tibialis posterior muscle is going to be standing shoulder width apart with your big toes in alignment. And I want you to push your big toes into the ground while you're gonna try to lift that inside of the arch. So almost like you're trying to roll your foot inward, contract that and hold for 5 seconds. You should feel a contraction through the inside of your arch and then probably up a little bit into your calf as well. So you're gonna perform 2 to 3 sets of 10 to 15 reps of this. Now this is a great exercise for those who maybe have more of an acute bunion where flexing the big toe is maybe a little bit too painful right now. So this is the first strengthening exercise I usually suggest for patients who have quite acute bunions. The next one we're gonna do is a ball squeeze calf raise. So you need a small little tennis ball. You're going to place the ball between your ankles. You're going to perform 2 to 3 sets of 10 to 15 reps where you are raising onto the tip of your toes and squeezing that ball together with your ankles. This helps with inversion of the ankles, which is what the tibialis posterior muscle does. So because remember, it plantar flexes and inverts the foot, is that by doing calf raises with a ball squeeze, you're directly impacting that muscle. This will help to strengthen the inside of the arch, helping to support your abductor hallucis muscle and minimizing the strain placed on your foot. And now remember, as I mentioned, if you do have a bit too much pain with flexion or loading the toes, then the first exercise would probably be the best bet to start with. But you can also use a TheraBand and wrap it around your foot and more so on the forefoot. And then you can actually do unloaded plantar flexion with inversion, active motion, and have the band pulling to the opposite direction so you are resisting that motion. And that's a great way to also strengthen the tib post muscle. So now that we covered the strength aspect, we're going to move on to the alignment. So we're going to talk about toe spacers. Toe spacers are a device that are designed to separate the toes and are commonly used to help correct misalignment, therefore reducing pain and improving function of the foot. I have 2 different kinds here. So one of them you can wear at home and the other you can wear in your shoes. The first method is quite straightforward. Simply wedge the spacer between your big toe and your second toe, then put on your sock and your shoe and you're good to go. This is an excellent opportunity for you to correct your alignment throughout the day, particularly if you're experiencing pain while walking. The full toe spacers are great if your feet are particularly tight. So start by wearing them for 5 to 10 minutes and gradually build up throughout the day. Ideally wearing them around at home, and I typically put mine on after dinner and wear them for about 30 to 60 minutes each night. If you're just starting out, you can begin by wearing them without putting weight on your feet. And then once you become more comfortable, I recommend walking around to mobilize your feet, which helps release the tension in your foot and muscles. All the products I'm using in this video, I'll make sure to link in the description below. Now I'm going to address a few common questions that I get asked in the clinic. So how often should I do these exercises? Daily for best results every day. Now, depending on your bunions, you may want to do all the exercise progressions, or you might only be able to do a few if your toe is pretty acute. So just remember, exercises should be pain-free, or if you feel slight discomfort, but it doesn't increase throughout the exercises and or cause discomfort after, then you're good to go. If these exercises are all too sore to do, then you really want to consult a therapist or doctor about your bunions. How long will it take for my bunions to heal or align? It's a difficult one for me to answer, as many factors come into play, such as the duration you've had your bunions or whether it's acute or chronic. If you're just starting to notice a change in the angle of your big toe, it's easier to make changes. However, if you've had them for a few years, it's likely going to take longer to see changes. I encourage you to be diligent with these exercises. If you genuinely want to see change, you must also address your footwear. It's challenging to see improvement if you're doing these exercises, but then return to your compressive footwear. So when should I see a therapist about my bunions? I strongly recommend consulting a manual therapist like myself for an assessment and treatment plan tailored to your body. Everyone is unique, and while this video provides the best evidence-based solutions for correcting bunions, it might not address each person's specific needs. An individual assessment will help you understand if you're placing additional stress on your foot or compensating in other ways. For instance, your bunions could be due to an instability in your knee or hip leading to walking pattern that strains your big toe. Therefore, a personalized assessment and treatment plan is always beneficial. So when should I consult a doctor regarding surgery? Well, when it comes to surgery, remember it's always a last resort. If you're having significant pain and limited mobility to function, then yes, you may want to consult a doctor, podiatrist, or orthopedic foot specialist to see if you're a candidate. But make sure you've done everything possible to rehab your foot and toe before you jump into this conclusion. If you have bunions, how long have you had them? And what are some of the major challenges you face? Feel free to ask any questions and I'll do my best to answer them in the comments below. So just a quick recap. Change your shoes if you're currently wearing narrow footwear. Work on mobilization and soft tissue release of your adductor hallucis muscle, which pulls your big toe inward, and increase the strength and stability of your abductor hallucis and tibialis posterior muscles so you build up your inner arch and avoid overpronating your foot when walking. And last but not least, use toe spacers to reinforce the alignment of your big toe. Now, I hope you have a better understanding of what bunions are and that you come away from this episode with clear knowledge of how to manage them. If you found this episode informative and want to learn more, stay tuned. In the upcoming episode, I'll be discussing plantar fasciitis, including its causes, symptoms, and rehabilitation exercises to manage this condition. Also, if you're interested in learning more about injury prevention and rehabilitation solutions, don't forget to subscribe to this channel for more content. Thank you for watching, and I'll catch you in the next one.